good morning everyone. So I'll be discussing regarding this new drug that is Iruplinalkib, and this was studied in INSPIRE trial. And this study is a Chinese study, and this was presented in WCLC 2023. So this Iruplinalkib is an ALK tyrosine kinase inhibitor, and prior to this phase 3 trial, that is INSPIRE trial, a phase 2 study was done, and the outcome of Iruplinalkib was seen in second-line setting after Crizotinib, and this drug has demonstrated a clinical activity in patients with localized, advanced, and metastatic NSCLC. So this phase 3 study came up, and it was a open-label, randomized, multi-centric study that was to investigate whether this new drug is more effective than Crizotinib in locally advanced or metastatic ALK-positive NSCLC. So this is the study outline. So they took stage 3B and stage 4 NSCLC ALK-positive patients, performance score of 0 to 1, ALK treatment-naive patients, and they randomized them to two arms, that is Iruplinalkib arm with a dose of 180 mg once daily dose, and Crizotinib arm, that is dose of 250 mg twice daily. And the primary endpoint was independent review committee assessed PFS, and secondary endpoints were investigator assessed PFS, overall response rate, duration of response, intracranial overall response rate, overall survival, and safety analysis. So this table is showing baseline characteristics, which was well matched. Median age was 55 years, and all patients were Asian, as it was a Chinese study. And important is that in the baseline, 25% of patients had brain metastasis at baseline. So this is very important. So coming to primary endpoint, that is IRC assessed progression-free survival. And during interim analysis, with a median follow-up of around 24 months in Iruplinalkib versus 24 months in Crizotinib, so they found that this new drug did better in comparison to Crizotinib, and median PFS was 27.7 months in Iruplinalkib versus 14.6 months in Crizotinib arm. This table is showing various secondary outcomes, that is investigator assessed progression-free survival. Again, this PFS was better in this Iruplinalkib arm. You can see that the median PFS was 27.7 months versus 14.7 months in Crizotinib. Regarding overall response rate, again, it was on the higher side in this new drug, that was 93% versus 89% in Crizotinib. Regarding median duration of response was again better, and it was more than doubled in case of Iruplinalkib. When we see the duration of response was almost 13 months in Crizotinib versus 27 months in this Iruplinalkib. Again, this table is very important, as I told that almost 25% of patients had baseline brain metastasis, and among them 15 versus 11 patients had measurable CNS metastasis in Crizotinib versus Iruplinalkib group. And when we see the intracranial overall response rate, it was 91% intracranial response rate was seen in Iruplinalkib versus 60% in Crizotinib arm. So definitely there is a better response rate even intracranially. When we look for a whole cohort, that is measurable versus and non-measurable CNS metastasis, again the overall response rate was better, and it was 58 months versus 25 months in Crizotinib arm. CNS progression was on the lesser side in Iruplinalkib. It was seen in 7% versus almost 13% in Crizotinib. Regarding adverse events, so as median treatment duration was more, it was almost 24 months in Iruplinalkib versus almost 13 months in Crizotinib arm. Despite that, the incidence of adverse events were similar. Any adverse events or grade 3 or grade 4 adverse events were similar in both groups. 2 mortality was seen in Crizotinib, while none in Iruplinalkib. And these adverse events leading to any treatment discontinuation or dose reduction was also again similar in both groups. So this new drug is safe, and there was no new adverse events seen in this new drug. So they concluded that compared to Crizotinib, the PFS was significantly improved over response rate, and also intracranial overall response rate was on the higher side in Iruplinalkib arm. Iruplinalkib was well tolerated without any new safety signals, and this drug may become a new treatment option for patients with ALK-positive and ALK TKI-Naïve advanced NSCLC. Thank you so much.